Hello guys. We're live now. We're here with a special interview that we're going to be having with the founder and CEO of Aimedis. This live program will be in English. So for those followers that speak Spanish, later we are going to be uploading a translation part, but this is a very special interview that we have the honor of Dr. Michael Kaldasch, the founder and CEO of Aimedis, is going to be sharing with us an excellent topic. With all this talk about the metaverse and the followers that we have that are in the medical profession are a little lost. Some are a little lost, and others are a little threatened even by this technology, but this is going to be changing the world. And this special case that we have with Dr. Michael Kaldash, he's a special founder because himself is a doctor, a medical doctor. So it's going to be very interesting. So please, guys, share this link now, and you can ask live questions. You can share this transmission with fellows, people that are in the same healthcare professions that you are doing, and please write us your questions, and we'll be asking them live. So don't miss this opportunity to share your thoughts and questions with Dr. Michael Kaldash. We're live in our Facebook, our LinkedIn, and YouTube, and in our Twitter account. So please share, like, and comment. And with further ado, let's give a warm welcome to Dr. Michael Kaldash. Dr. Michael, thank you very much for your time. I know that you guys are very busy. Uh, well, let's get the ball rolling, Doctor. The topic will be the metaverse and the next generation of healthcare professionals. So, welcome, Doctor. How's
Yeah,
everything doing?
yeah, Miguel, thank you very much for the invite and thank you for the opportunity to speak about what we do. Very happy to let you know about what we do and what our plans are, what we've done so far, and where we see at least parts of the future of healthcare. So thank you very much.
Excellent, Doctor. First things first. I'm curious about your inclination, being a medical doctor. When you decide to go and share this type of enterprise, doing this type of work in the metaverse, what jumped to you to do this thing?
Yeah, so I have had a quite long clinical career behind me. Started working in a hospital in 2006. I've been working for many years, and not only in Germany but also in France. And when you are in that business for some time, you notice so many deficiencies, right? And I don't have to go into the details here because everyone knows what the problems in modern healthcare are.
Yes.
And so already during my hospital time, together with my partner Ben, who's the co-founder with me, and um, yeah, we built on digital health solutions to tackle some of the problems. I mean, speaking about patients coming to an emergency room or intensive care unit, you have a lot of problems in getting data about these people, right? And so we thought forth and back what to do and how to build digital solutions to improve the situation. So that was the beginning of our journey in digital health, and we followed that up. And after our career in hospital, we founded Aimedis, and the first product that we had was a digital health platform that combines different healthcare applications like video chat with doctors, all these things, right? And yeah, we just expanded the project. So we said, okay, we don't want to stop with classical e-health applications, but want to take a step further ahead and step into the Web3 era. where of course NFTs, blockchain technology is part of, but especially the metaverse. And yeah, so a lot of problems that are occurring that maybe cannot be solved optimally with simple digital health solutions can be tackled with metaverse applications, but we can speak about this in the next minutes. But so that was just a logical step to take from digital Web 2 solutions into the Web 3 space.
So you went not only to solve current problems, but you saw what's happening that not even that working with digital health wasn't going to be enough, and you foresee the future and try to put your know-how in something that is going to be a little bit further away in the practical solution part of the healthcare industry. We're talking about a very slow industry that digital health people are trying to solve problems, but it gives them a little bit of problem so that the healthcare workers can be taking those digital solutions into account. So I was curious about that initial point that you are trying to, as a medical doctor, trying to do this project of the metaverse. Well, sorry about that, because I was very curious, because typically doctors are not very tech inclined, or typically is what we see regularly. And tell me about what your colleagues, when you were telling them that you're doing this whole universe in the metaverse that is solving real world solutions in the metaverse, but it's a big step for them. Like, okay, I'm solving the clinical ¿cómo se dice? Un clinical record. From a clinical record, digital clinical record, to a whole universe is a step.
Mm. Yeah, so first of all, it's interesting to see how many doctors and healthcare professionals like the idea. So I initially thought there would be much more hesitation, let's say it like that, where people would say, is this something that can be used? Of course, there are a lot of questions involved, right? And there are a lot of theoretical problems that can occur with a digital health solution in a 3D environment. But so far, the resonance was very good. And I can tell you, as you say, not many doctors are very tech savvy. It's like maybe because of my and also my partner's history. Before I studied medicine, I was a professional gamer, and I was always building computer games. So I was in that space
There's
for quite some
the
time.
background.
Yeah, exactly. Yeah. No, it's something, of course, that you need to know about, because I notice it when I speak to people in the space too, because when you have a digital health platform, it's something completely different than a computer game. Because when you build a
Yes.
metaverse, you basically built a computer game, and developing from a blockchain digital health company to a game development studio is quite a shift, and takes a lot of effort. But so far we tackled it very well, and we have great colleagues and great partnerships, people that support us, that are in the space, so that works quite well.
Doctor, tell us about the real problems that this technology is solving right now, because when we're talking about jump to the work, please explain in a simple word so all people can understand what you guys are developing. What is Aimedis
So
developing?
to tackle it down to one word, it's communication. You can use a lot of terms and all these buzzwords like blockchain and metaverse and stuff, but what is the problem in healthcare? Most of the problems in healthcare occur on the base of insufficient communication. And of course, standard Web 2 digital health solutions can catch up a lot of this, so you can solve a lot of communication problems. But when it comes to a deeper relationship, and when there is a business going on between the patient on the one side and the healthcare industry on the other side, it's not only a business, because there is no real equality, right? Because the patient relies on what you as a doctor, as a pharma company, as a hospital do. So they are not real customers. They just believe, and they have to believe you. While, of course, they need to feel somehow cherished and understood, and they need to feel safe, okay? And that is a big issue. When you speak, for example, via a 2D screen, just as like a Zoom conference, etc., that is good when you speak about maybe business operations and some things like that are really not so much personal. But when it comes to personal exchange and healthcare issues, there is still this distance, right? The patient doesn't want distance when it's about healthcare. People are very much afraid of what's going on. They have questions they may be ashamed of. So they don't want to be an anonymous number. They somehow want to feel cherished and accepted and understood, and also be part of the conversation, right? So in a virtual 3D environment, and everyone who has already tried out virtual reality environments, and not only in healthcare but in any space, might it be gaming, might it be live chat, whatsoever, will know that you feel much more there, right? It's immersive, right? So you have many more possibilities of communication, but you also understand things from a different angle, because the third dimension really gives you another level of understanding things, of seeing things.
Immersive participation.
This immersiveness is something, and it improves the communication, because that's what it's about, right? When you speak to a pharmacist, when you speak to a doctor, when you learn as a medical student, or you learn as a patient how to apply your insulin, for example, when you're diabetic, this third dimension really helps a lot, and it gives you just another dimension. And I mean, in the long run, we're not only speaking about virtual reality, because this is just a part of it.
Yes.
But it's about a mixed reality, right? So you combine the real world with the virtual world, and to speak about the metaverse and to distinguish it from a VR experience, because VR experience is not the metaverse, but you do real transactions in terms of, okay, doing payments and getting healthcare services on the one side, and also the data part is very, very important when it comes to the Web3 applications and metaverse, because the data business, so you use your data in a completely different way than you did before. This all comes together and gives people really many more opportunities.
Excellent. And the healthcare professionals are starting now their careers, and they are trying to be competitive for when they are developing their careers. What do you advise them to the view of tackling technology in general for their profession, but also seeing this technology that it's solving a lot of problems with the security part and the experience part? What do you advise to those young doctors that are starting the career? And how they see and how they can get involved in the metaverse for their careers.
Yeah, so first of all new kind of technology gives you great new opportunities, but you always have to be careful, right? Because whatever you
Yes.
do as a doctor, you cannot just go and take some fancy tech and use it, because you can also cause damage to a patient. So whatever you do,
Yes.
first have to make sure this technology really serves the patient, improves treatments, outcomes, security, whatsoever, and then apply it, right? That's why we, for example, did our first medical trial with the university hospital in Switzerland and in Greece, and we treated the first patient inside the metaverse to prove that what we do is real healthcare and that it really serves the patient. No matter what, a digital and a virtual environment can never replace the real treatment, right? So what we do with Avalon, what we do with the digital health solutions, is we empower the patient to get all the services that are possible inside a virtual environment, to get these services from anywhere in the world. Therapies, consultations, education, social interaction, all these things that you as a patient or as a professional can do. But when it comes to real treatments, right? So for example, someone tells you, I have abdominal pain or I have heartache, no one will say, oh, hey, go to the metaverse. You will tell those people,
No.
go to an emergency room, go see a doctor in real life.
Yes.
And that is also one of the big opportunities that we have with these digital health solutions and the Web3 digital health solutions. It can take away, or it can help people who don't need an emergency room, who don't need a direct doctor contact, to stay at home, save time, save money, be more comfortable on the one side, and on the other side, people that really need a doctor, to have a doctor in an emergency room or in a practice with much more time, because people that normally came to a practice or to an emergency room can now stay at home and can use these digital health services, while people that need an actual treatment, that need to have a surgery or a bypass or whatsoever, they now can have their doctor, they can have a doctor with more time for them, which is very, very important, because nowadays a lot of doctors don't have a lot of time for a patient. Some doctors in a practice, they see a patient and it takes 3 or 4 minutes max, and you cannot do a complete and good treatment or a good anamnesis in 3 or 4 minutes. You just don't have time for that. So imagine you take all the patients that must not be at a doctor's office, that must not be in an emergency room, and bring them to a digital health solution. So you have much more time for the patient that actually need a one-to-one consultation or an examination or a surgery, right? So this is the big opportunity. And that's what I would tell the young colleagues: use this technology wisely to have time for the patients that really need your attention now in real life, okay, that need a treatment now, and use the technology to distinguish these patients and serve patients in a digital environment where there is space for it and where there's no medical emergency that requires immediate attention from a doctor, or even in a critical situation.
Where they can go and take more, know more about the metaverse. I know that you guys have published a paper about the use of the metaverse in medicine. Can you tell us a little bit about that? I mean, in a little while. But what do you advise to young doctors so they can go and try to understand more and be trained in this type of technologies, because you have a background also in the gaming industry, and you know this type of technologies and the uses that they have also in other industries, because it's not used only in the healthcare industry, the simulations and the experiences, the experiences that the metaverse has, but it also gives the tools for doctors. So what do you advise the doctors where they can find more information about how to use this type of technologies in their practice?
So first of all, of course, they can get in touch with us so we can talk with these doctors, with the colleagues that are interested in what we do, how they can use it in their daily workflow, right? What they can do to train this. But first of all, people need to get in touch with this technology. You can read about it. You know, there are a lot of possibilities of getting courses and seeing the possibilities of virtual reality and technology. So you first have to understand the technology, also blockchain technology and all these digital health solutions that are already out there. There is so much to learn, so much to see. That is definitely something, because a lot of doctors, and I know it firsthand, when you're in hospital and you work every day, 10 hours, 12 hours, you don't have time for these kind of.
A little time, yes.
Then you just
But
rush from one patient to the next. You do the discharge letters. You go to the emergency room. You go to the ICU. Then there's someone from the family who wants to speak to you. You don't have time to really sit down and think, right? And that is a real issue. So you actively have to push this, and you have to actively have to take your time to get in touch with new things, or to think about new processes, and even encourage your colleagues to do so, because when it goes on like it goes, you know, people say it always worked like that and it will never change, and that is the real issue here, because no one really takes or wants to take a step ahead and change things actively, because most of the people don't have time or the energy to do so. So that is definitely something that should happen, and that's not only bound to metaverse or digital health solutions, but
yes,
to every process in the healthcare system, right?
And it's a critical time because we're seeing shortages in healthcare professionals in developed countries like the United States, Spain, and you have the need of doctors right now. And what they project the need of those doctors for the future, it's more dire the situation. So the use of technologies, what I have seen in technologies like telemedicine, that's basically one of the digital solutions that are more like getting to know doctors now. The use of telemedicine is a solution that can help in those type of shortages of special needs that the people have. Um, talk about doctor. Can you talk about the paper that you guys got published that I saw that you have in your website?
You mean the one with university hospitals?
Sorry.
You mean the ones that we published with the university hospital?
Yes.
Yeah. So it was quite a simple use case that we had there. So we had patients with angina that are basically at home and record an ECG at home. Because what I've not said before is that, not mentioned before, is that we use IoT tracker devices, IoT devices, and combine this data and monitor this data into the virtual environment. Good example is, for example, you can do stress relief therapy, and the patients or the participants wear a heart rate monitor, and this heart rate monitor measures the heart frequency, of course, right? And then inside the metaverse, you see that avatar with a number, with the heart rate above their heads. So you can do a biofeedback therapy inside the virtual environment. So whenever you do stress release, it monitors somehow, right? You can measure this, and the heart rate, for example, is a good indicator of stress. So when you see the heart rate goes down, you know the stress is going down, right? At least you think that, and that is something that you can show. And so what we did, we combined the cardiologic patients with an ECG monitor. The ECG monitor the patient used at home and uploaded the ECG to our platform. Inside the platform, inside the virtual environment, they met a doctor. This was from the University Hospital of Lausanne in Switzerland, and they discussed the ECG. Is there something or not? So is there a reason to really come to the hospital, or is the ECG without any critical finding? So it was a quite simple process, but straightforward, because it really took away headaches for the patient and for the doctors. So the patient didn't have to go to the hospital over and over again, could just stay at home, take the ECG, upload it, discuss with the doctor in a virtual, safe environment, watch it in 3D, and then feel safe, right? So that's basically what we did. But that worked out very well because the patients were happy and the doctors were happy. Everyone said, well, this is a good opportunity because it gives me security from my living room. And the doctor says, okay, cool, this patient is not coming to the emergency room. There is not, again, a slot taken by someone who maybe does not need acute medical treatment, but we have the slot now for someone who does need actual emergency treatment. So yeah, there was a win-win situation for everyone, basically.
Excellent. They can find this work at your website that is
Yeah, on PubMed. Yeah, you can see it on PubMed.
aimedis.io.
You can search
Yes.
on it on PubMed. So all the doctors know PubMed, right? You can go there.
Yes. And we also going to be sharing the link in this video, so people, if they're seeing this transmission later on, they can click and download the that paper. We're open to questions from the audience. Well, it's basic a lot of basic questions, but as I told you, we have our community is more doctors and specialized, and this is the type of things that they are asking is what is the metaverse? Are very basic questions, but the reality that that the healthcare professionals are seeing, and they have these type of questions. What is the metaverse? So we're a very early stage in this type of technologies, in the adoption of this type of technology, because I have seen something interesting, Dr. Michael. You can correct me in that respect. There's been a move from traditional programmers like in gaming industries and stuff like that to all type of industries in the metaverse. Their developers be migrating to those types of industries. So that's very interesting to see. But the reality is that the people are those doesn't have like a clue. So in simple terms, what can you tell about a definition about the metaverse?
So the metaverse is basically it's a virtual environment that combines different technologies, including virtual reality, including augmented reality, including Internet of Things, brings together real people that do real communication with each other, and on top performing or mirroring from the real world the economy and the data economy. So you can basically compare it to a computer game, right? Something like World of Warcraft or GTA, but of course without any weapons, right? So with a real healthcare environment, with
And the
real people,
violence.
yeah, and without violence, normally, yeah, for people that can people speak to each other in a virtual environment and use the opportunities that this virtual environment gives you: content, way of communication, partially anonymity, right? Decentralization, if you include the blockchain technology, data and real world economy. So you do business, you get services there. Yeah, that's basically broken down to a few words. The metaverse is not VR only. Of course, virtual reality is an essential part of this because it gives you great experiences in 3D and
Yes.
all together. It's fine, but it's not that you have a VR glasses and a virtual environment that doesn't make it automatically a metaverse, right? So the metaverse is much more, and I said it's about communication, it's about getting and acquiring services, it's about solving real world problems in this virtual environment. I would break it
Excellent.
down to that. I mean, you can go into
Yes.
a lot of more details, and there are a lot of definitions for it. There are some definitions that include the blockchain always in the metaverse, and for trust reasons and for authentication of operations, but we
The
don't want to
privacy
go
of the
there.
data privacy of the
Yeah,
patient's information and in the information that you're sharing with that. And other things that people got mistaken is Bitcoin up? Is this affecting something like this project? Because people doesn't know how to differentiate. But and this is the type of questions as we see here. Manuel Ogaza is asking how to react to the news of the last days in crypto industry. Does it have an effect on Aimedis? This type of questions I have seen that arises in
yeah,
this industry in particular. That
yeah,
we're talking about blockchain, the metaverse. It got mixed up.
yeah. Manuel, thank you very much for the good question. No, it does not affect us. You know, especially when we talk about the crypto markets are going up, going down. Now there was a crash of
Yeah.
one of the biggest exchanges, FTX, and you always have a trust issue. We don't see blockchain as our main focus. It is a tool that we use. We do have a cryptocurrency, of course. We do have non-fungible tokens, the NFTs, but we don't use them in that classical way that we use it for art, right? We don't build everything around the blockchain. The blockchain is just a tool, and the blockchain is a fantastic tool. Banks use it, big industry leaders use it, but not to promote funny little pictures, but to give it or to use it as a tool for transparency and for trust. Because what the blockchain does, it saves information immutable, right? So there is a real authentication of information. Once something is on the blockchain, it cannot be manipulated or changed afterwards without anyone noticing it. So it's a tool to create trust. And what is more important in healthcare than trust? Basically nothing. And especially when we come to the internet, and let's speak about the metaverse. Let's speak about you meet a doctor in the metaverse. Okay,
Who is he?
I take an avatar and I put on a coat and I say I'm a doctor. Then you say You are a doctor, you have a code, okay, but how do I know you're a real doctor? You could be someone who has never been in touch with healthcare. So how do you know that? Blockchain technology will solve that issue, because doctors, for example, can save their identification and their license inside the blockchain, inside a non-fungible token, a unique piece of digital information on the blockchain. And you as a patient can see if this doctor is a real doctor or not. So how else would you trust someone? Even if someone shows you just a piece of paper that says,
Yeah.
I'm a doctor, you don't believe him. Why should you, right? But when blockchain technology is there, you can always follow up. Where is this information coming from? We also will work with governments and with regulators on that, so that regulators have an active access to these kind of information. So the doctor who is representing themselves as a doctor in Avalon is the doctor in real life. So people can be sure, okay, I've seen the information, there's a proof of authenticity, I'm speaking to a real doctor. That makes it super important. But it's a tool, right? So it's not about talking about these technologies, but making them usable for the patient and serving patients with that, and serving the industry with that. It's like when you go to a ATM, or when you pay something with your credit card, you just swipe the card. You don't think about the technology in the background.
It's like
serves.
switching off the light. You don't
Exactly.
understand the principles of electricity. You simply go and put the light on.
Yeah.
So, what do Aimedis have to offer now, and what do you guys have in the future? What can you share with us that doctors can see, and how to go to you guys, and the platform that you're developing? What people can find in Aimedis and in Avalon, that is a project of Aimedis.
Yeah, so first of all, we are already working with our platform, right? So the platform itself is live. You can go to it via imedis.io and check it out. The Metaverse application, the first version, will be available end of this year. So you can already start going there and start using the first applications, can visit the first environments and experiences. And yeah, this will be built out more and more. Next year, beginning of next year, we are in Dubai at the Arab Health, and we will present virtual Dubai and present experiences in virtual Dubai that can be visited, that can be used. Doctors will already be able to have services there. There are a lot of information services, some medical gaming applications. So very, very soon people will be able to use this application on their own. And initially it will be available on PC, also on Mac OS, and in a later stage also on mobile devices and on devices like PlayStation or Xbox. So basically everyone will have access to it. Virtual reality glasses are always optional, so we don't, this is never mandatory, so people can use the system without a virtual reality glass. Of course, in some cases it makes more sense, speaking about virtual rehabilitation applications, training stuff, etc. But that's up to the user, so we don't force people to use this technology.
And what type of services that Aimedis have for like doctors or for hospitals? What they can find, and what opportunities are open that they can participate now in Aimedis, so they can get involved in this developing a metaverse that you guys are doing, and the opportunities that they have coming now to you guys, and getting part of what they do in your the metaverse that you guys are doing.
So there are a bunch of applications. The initial applications for hospitals are therapies and consultations, psychotherapy, rehabilitation therapy, consultations, speaking to the patients, making appointments, right? That is something we do. Educating and training for the medical staff, the nurses, for doctors, and also education for patients and their families. Social interactions, so there can be self-help groups for patients. Also, hospitals can organize that inside the virtual environment. Very, very good application that we start with very soon will be when it comes to addiction, right? So when we speak about these anonymous alcoholics or drug users, you know, some people go to these anonymous groups, but still it's not really anonymous. Avalon will change that, because you can go there with an avatar and you can talk to people that suffer the same problem. and it gives much more confidence because you have the security of anonymity. You can stay at home, don't disclose your face, don't disclose your voice, your ID. It's always a problem to speak about these things. So that can be performed in hospitals. We'll be able to offer that. I mean, there are a lot of other things. You can offer medical gaming, very interesting for pediatric patients, which are much more afraid of hospitals than most grown-ups, right? So it's good to have tools to at least ease a little bit the burden of a disease. But we start with the things that I mentioned, and that's already a lot.
And you have those type of services. For instance, if I have um, a psychology consultation office, and I have 5 psychologists, and I want to do and go and make a part of my practice in the metaverse, so I can get
Yeah,
patients. What do I do? Do I contact you guys and we can
yeah,
work on that solution
yeah.
together? What type of
Yes.
services that you offer in
So what we do is, normally, and the metaverse is working in a way that you have to buy land and you have to build on it and you have to build all this. So we don't do this, because what we don't want to have people more problems than before. So what we do is we offer complete experiences. That includes the areas, that includes the institution, the estate, that includes the functionalities. So people can work with us and getting, what's the English word? When you buy a house and you get the key, you just move in and you're good to go. So that's what we want to do. And we offer that to the doctors and to the partners that work with us. So they
so they
just
don't
get
have to get involved in the minutia and the resources that and the knowledge that you need to do a solution like that. So if I have that hypothetical um, solution, that hypothetical office, psychology office, and I have those 5 psychologists, I can go to Aimedis and I say, okay, I want to go and put this practice that I have in the metaverse. You guys can help me develop my space and all
exactly.
the processes that I have to do, because I imagine like I have to have like the patient record to see validate that patient has the record, and I see him and how to get paid. All of these services you have now on you or you're working on.
Yes, yes. So they can just come to us and say, I want to do this and that. 1, 2, 3, 4, 5 psychologists want to do this, want to do that. Need an environment with 4 or 5 rooms whatsoever, and then we plan this together. The good thing about our system is it's not just a piece of gaming software, but we include medical IT compatibility, and we follow GDPR compliance for the European market, HIPAA compliance for the US market.
The other question that I
Yeah,
wanted to ask, because it's a space in the metaverse, was you have a medical practice that is linear in your country, and how does that work, that you are compliant, and if you're seeing a patient that is like in Germany and I'm in Spain, I don't have a license in Germany. So those are interesting questions that we are going to see how it get evolved with the use case of this type of technologies developing, right?
yeah, true. But you can match all this by offering different spaces in different legal areas. So for Europe, you have the GDPR compliance, for the
Yeah,
US HIPAA compliance, and you divide this. We do this with the maps. So, for example, European cities,
geolocation.
US,
Mhm.
exactly. And of course, we follow these guidelines. That was, by the way, also one of the reasons why we didn't join another metaverse, because all the other metaverses out there are basically retail products, right? So it's not for healthcare. It doesn't connect to fire, doesn't handle DICOM files, it doesn't follow these end-to-end encryption and regulator rules, and that's what we do with Avalon. So we have a real medical product here, right? And it also connects to our platform, the medical platform that is handling that data. So all these products work together. So it's not different products, but you can also use the Aimedis digital health platform inside Avalon, use the medical records, use the appointment system. You can do all that. So it's I think, a very comfortable situation for the professionals, where they don't have much headache and they don't have much time to lose, because time is money, even for doctors, and they don't have time, and they don't want to waste a lot of time by learning new things. You know how difficult it already is to learn the hospital information systems or the practice information systems, and you don't have the time to again learn another tool and waste much time in getting adapted to that.
Excellent, Michael. The last question, because I know that you have a tight agenda, and we're very appreciative of your time. What's one last question? Okay, if you guys are developing one metaverse, when this metaverse that are developing, like the ones that is doing Meta and other people's are and Decentraland and all of those metaverse are going to be uh, live or are live, how can they this type of platform that you guys that is work is built for giving the healthcare industry space, how the other metaverse can connect? Are you working on something that is going to be easy to jump from one metaverse to another, or go here
Yeah.
and do the services? That is a little bit confusing with people that have a little knowledge, like, well,
Mm.
like about this type of environments that we're going
Yeah.
to be jumping from one to one. I think it's not going to be like Facebook and Twitter, for instance, to the different platforms. So
Yeah, so good question. Of course, there is not. So first, we have to talk about the definition. So we are not building a metaverse, but we are building a metaverse world or application, because there is only one metaverse, right? And basically, all these different metaverses need to connect to that. That's, of course, otherwise it doesn't make any sense, right?
yes,
Because the actual web 2 is also speaking with each other. You can go from one website to the other without any barriers. And that's exactly the same with Web 3, which includes metaverse worlds, which includes blockchain technology and all these things. You have to be able to jump from one world to the other. Okay? We are part of the Metaverse Standards Forum. So we're actively working on
the
implementing
standard.
standards
Mhm.
to make it interoperable with other metaverses. So you can come from Decentraland to Avalon and go from Avalon to Meta, because that is the idea, right? In the end, otherwise you will again produce a silo, and no one wants silos, not in data but also in the social communication. And when you build this new web, you don't want to build another closed world where you cannot communicate with the others. So yes, it will be possible to jump from all the metaverses to the other, and it will be able to communicate and take your information from one metaverse to the other. But we are specialized on the healthcare part, and there are other metaverses that do their own things, and that's how it will work together in the end.
And in this early stage of technology, I experienced I experienced the when the internet came up, and we were working like with email, and we didn't know where this was going, and it reminds me of this era, before the browsable web. And this is the stage that we have. But what I have seen is that we're going to be running quickly this time, with this type of technology, because
Yeah.
has come in in a stage of the world where people are open to it, and it's in need of medical attention, specifically. So, and thank you, Dr. Michael, for the time. I don't know if you want to add something about some recommendations to the healthcare professionals, remembering the subject of this program, that is the next generation healthcare professionals. What do you advise to these people that are going to be entering in this profession, or are in this profession and would like to go and find out more about the metaverse?
Yeah, I mean, join us and read a lot about this and open your minds for this, because you don't learn anything in university about it. So you have to be very open-minded. I mean, that's basically all I can tell. So everyone has to decide for himself if this is something that is applicable to the actual situation or to their work. But I think it's very important to already think into the future. I mean, pandemic has taught us a lot, I think. So we know where a lot
Yes.
of problems lie. We have to learn from that. So going on like we did in the past is not going anywhere. So I mean, that's maybe not too much of a clever advice, but a quite obvious one, which has to be regarded. Let's say it like that. So yeah.
Well, excellent. Thank you very much, Dr.
Yep.
Michael Kaldasch. We have been speaking with the founder and CEO of Aimedis, the metaverse that is developing for the healthcare professionals and the healthcare professional. So thank you very much, Doctor. Remember all people that you can follow us and Facebook, Twitter, LinkedIn, and YouTube at DiarioSalud, and you can have more information about the healthcare industry and keep getting you guys more interesting stuff like this for our Spanish people, speaking community. Please, we will be uploading this in a version in Spanish, so please stay tuned for that. Thank you very much, Dr. Michael,
Thank you
about
too.
for this time, and thank you for my patience in my not very good looking English.
It's great. Thank you very much. Thank you.
Uh, Excellent, guys. Well, have a nice evening then. Bye bye.
Bye bye.